Well, Hafaday and good afternoon and welcome to the Office of the Governor of Guam. We're delighted to have you with us on this beautiful Friday afternoon to proclaim January 2025 as Leprosy Awareness Month and Sunday, January 26, 2025 is World Leprosy Day. Before we proceed, of course, I want to recognize the presence of the Honorable Lourdes A. Leon Guerrero, our Governor of Guam. Let's give her a round of applause. Also representatives. Our notable guests joining us this afternoon started with Johnny Sabanas, Acting Consul General for the Federated States of Micronesia. Our Director for the Department of Public Health and Social Services, Teresa Ariola. Our Chief Public Health Officer, Catherine Encao. Ms. Julieta Kaneni, Registered Nurse, Community Health and Nursing Services Administrator for the Guam Department of Education. Mr. Chiman Bakwa, Program Manager for the Bureau of Communicable Diseases at the Department of Public Health and Social Services. Ms. Ashley Rodriguez, Total Guam Foundation. Also with us in the room is Anderson Air Force Base Public Health. Joining us, Captain Chelsea Lewis. Hafaday and welcome to the Office of the Governor. And I also want to acknowledge those who have had and survived leprosy. Let's give them a round of applause. Without further ado, to tell us why we're all here, I want to give the floor to our Director for the Department of Public Health and Social Services, Teresa Ariola.
Thank you, Crystal. Thank you, Governor. Ladies and gentlemen, good afternoon. It's Friday. Not that that matters because we're constantly working, right, in public health. And so thank you. Thank you, Governor, for making the time. This was supposed to be sometime in a different date, and she was able to accommodate me. So thank you so much for that. Members, Council General Johnny, thank you so much for joining us. Distinguished guests that have been announced, thank you so much. Partners, military partners, my wonderful staff from public health, you know who you are. Thank you so much for all the work you do. Ladies and gentlemen, thank you for being here and joining us. Every year on the last Sunday of January, the world observes World Leprosy Day, a tradition started in 1954. This day was purposely aligned with the anniversary of Mahatma Gandhi's passing on January 30th in honor of his compassion of those affected by leprosy. Today, I'd like to start by sharing a snapshot of the current situation regarding leprosy on Guam. The incidence rate of Hansen's disease is 11 cases per 10,000 individuals. From 2011 to 2024, we reported 164 cases, with 11 new cases identified in 2024. Most patients are between the ages of 15 and 44, with the majority being male and not born in the United States. For individuals not born in the U.S., the most common country of origin is within the Pacific Islands. With these statistics in mind, I am proud to introduce January 2025 as Leprosy Awareness Month and asking the Governor to declare it upon her powers and to mark World Leprosy Day. To further our commitment, we are excited, very excited to launch, and I'm so pleased because I was able to sign it once I got into public health, the Guam Path to Zero Leprosy Roadmap for 2024 to 2030. And just so we can see, this is how it looks. And we're very excited because this is something that's really, really long time coming. This ambitious initiative reflects collaboration between the Department of Public Health, Social Services, the Total Guam Foundation, and our international partners, the Global Partnership for Zero Leprosy, or better known as GPZL. This roadmap is our guiding compass as we work towards eliminating leprosy in Guam. It builds on the World Health Organization's Neglected Tropical Diseases Roadmap 2021-2030 and aligns with the Global Leprosy Strategy of 21 to 30. Together, we are aimed for zero disease, zero disability, and zero stigma. The roadmap focuses on 5 key areas: reducing and eventually eliminating leprosy transmission, preventing new cases from emerging, limiting the introduction of leprosy to Guam, ensuring proper care and management for individuals affected by leprosy, and raising community awareness about leprosy, and reducing and eliminating the stigma. Our theme this year is Beat Leprosy, End Stigma, and Advocate for Mental Well-Being. This message is at the heart of our mission. We are not just fighting a disease, we are fighting the stigma that surrounds it. Leprosy should never define a person's worth. Instead, we must respond with compassion, respect, and understanding. Looking ahead, the department and our TB Hansen Disease Program, led by very capable Mr. Chima here, continue working hard to educate our community about leprosy. This includes spreading awareness about its symptoms, emphasizing early diagnosis and treatment, breaking down patient barriers, and promoting self-reporting. Together, we can stop leprosy in its tracks. Let's take this time to recommit ourselves to building a future where leprosy is no longer a source of stigma, where it becomes a chapter of history, not an ongoing challenge. I thank you so much, and I look forward to working with you all. Thank you so much.
Cesar's Masi, Director Ariola. I now want to give the floor to Ms. Ashley Calvo Rodriguez from Toda Guam Foundation for her remarks.
Thank you, Crystal. Good afternoon, Governor, Director. The Toda Guam Foundation, or TGF, is a registered 501c3 nonprofit charitable organization dedicated to providing no-cost medical and preventive care, education, and support to low-income children and families in Guam. Our efforts contribute significantly to the health and well-being of the community. The Guam Path to Zero Leprosy represents a collaborative initiative between the Toda Guam Foundation and the TB Hansen's Disease Program of the Department of Public Health and Social Services, both of which are members of the Global Partnership for Zero Leprosy, or GPZL. This initiative fosters a global coalition committed to the eradication of leprosy, also referred to as Hansen disease. The mission of GPZL is to pursue the goal of a world free from leprosy through a tailored approach to at the national level. GPZL engages with national leprosy programs and international stakeholders to develop customized strategies that address local needs and priorities in the effort to end leprosy. As the fiscal manager of the mini grant funding from GPZL and the secretariat responsible for developing the Guam Path to Zero Leprosy Roadmap, TGF occupies a unique and critical role in advancing Guam's initiatives to reach the objective of zero leprosy by the year 2030. This objective includes achieving 0 cases of disease, 0 instances of disability, and 0 stigma and discrimination associated with leprosy. In observance of this year's Leprosy Month, TGF endorses the call to action represented in the theme for World Leprosy Day: Unite, Act, Eliminate. In close collaboration with DPHSS, TGF will continue to enhance awareness of leprosy, leveraging its unique position within the community to promote public education and facilitate early diagnosis. Thank you.
Cesar's Masi, Ashley. I now want to draw your attention to the TV in front for video remarks from our international partners.
And hello from New Zealand. My name is Jeff Warren. I'm the CEO of the International Federation of Anti-Leprosy Associations, or ILEP. ILEP's a federation of 14 international organizations involved in leprosy, and those organizations currently work in around 60 countries or territories, though sadly not in Guam. I'm also a member of the leadership team of the Global Partnership for Zero Leprosy, or GPZL. GPZL was founded around 5 years ago to become globally the organisation with the broadest set of stakeholders in leprosy. Those stakeholders include national programs, organisations of people affected by leprosy, NGOs, Novartis, the pharmaceutical company which donates anti-leprosy drugs, scientists and researchers, WHO as observer, and more. GPZL's initial tasks were to produce a consensus research agenda for leprosy, which was published 2 or 3 years ago, and to produce what we call a country model to support countries to develop serious plans to work towards zero leprosy. In GPZL's terms, zero leprosy means no transmission of leprosy, no leprosy disease, no new disability from leprosy, no stigma and discrimination. Over the years, GPZL has supported quite a number of countries to undertake thorough reviews of their leprosy situation and then to develop roadmaps and finally detailed action plans towards zero leprosy. GPZL got interested in Guam through Mr. Bill Gallo, who until June was director of the GPZL Secretariat. In his previous role, Bill had worked closely with health leaders in many islands in the Pacific, including Guam. So when the opportunity arose to support Guam in the preparation of a zero leprosy roadmap and action plan, GPZL took that up with a financial contribution and the provision of materials to support a self-guided journey towards the roadmap and action plan. And this is the journey that you're currently on. I'm very sorry not to be present in person to support you in this important endeavour. I had the privilege of spending time with Chima Mbakwe in Manila in July and got a good understanding then of the approach that you were taking, especially these stakeholder meetings, which are a very necessary element of the process. This is an exciting moment for leprosy in Guam, and an important one as you figure out together the path towards zero leprosy. I wish you the very best as you work together towards that goal. Si Deus mas.
My dear colleagues in Guam. My name is Dr. Vivek Lal, and I'm the team leader of the World Health Organization Global Leprosy Program. The Global Leprosy Program provides technical support through evidence-based guidance, monitors the leprosy situation globally, and provides overall leadership by bringing all stakeholders together. I begin by congratulating you on your leadership in developing a roadmap towards the elimination of leprosy disease in your country. This stakeholder consultation is a testimony to Guam's resolve and commitment in addressing this ancient disease. The Global Leprosy Strategy 2021 to 2030 is one of the disease-specific strategies underpinning the WHO roadmap for neglected tropical diseases. It is a bold and compulsive one, and it sets out to change and challenge the existing paradigm. Incorporating the goals of zero disability and zero discrimination, this strategy has been boldly entitled towards zero leprosy. It has encouraged us to reset the target for leprosy as elimination of disease, defined as no new autochthonous cases as a result of interruption of transmission. An analysis of new case detection shows that countries that have reported zero child cases for the past 5 consecutive years can be considered for interruption of transmission. Contact screening along with single-dose rifampicin as chemoprophylaxis has shown promising results and could be a game changer. Ladies and gentlemen, these opportunities invite us to renew our commitments and revitalize our efforts. Strong surveillance systems, along with strengthened partnerships of national programs with persons affected by leprosy, civil society organizations, and WHO, are crucial for countries in their path towards interruption of transmission and elimination of leprosy disease. In the end, I wish you all fruitful discussions for the day and assure you of all support from WHO. I hope I have the privilege and the honor to visit your country soon. Thank you so much for having me here.
Good morning, dear colleagues, and greetings from Manila. My name is Kazim Sanikula. I am the team lead for neglected tropical diseases here at the Regional Office of the World Health Organization for the Western Pacific. I'm sorry that I couldn't join you in person because of some prior commitments. However, I'm happy that I'm joining you through this short video message. And I really want to congratulate the Department of Health and Social Welfare of Guam and to the Guam Foundation for organizing this very important meeting. Since the elimination of leprosy as a public health problem in Guam in 1994, we see a very good progress against the disease across all the indicators, from new cases to grade 2 disability and other indicators. However, last mile is always a challenge, especially in eliminating a disease or interrupting the transmission of a disease. And we clearly are in the last mile situation in Guam in terms of elimination of the leprosy disease. However, with the sustained efforts that are ongoing in Guam and with the partnerships that we see on the ground, there is no doubt that we will hopefully eliminate leprosy diseases very soon. And I very much look forward to the findings of this review, and I wish you all the very best in not only developing the action plan, but also implementing this very robust action plan that you are trying to develop. And we at the regional office are always happy to provide any assistance and support that you may need in your efforts towards zero leprosy. Again, I thank you very much, and I wish you all the very best.
Alpha Day, and greetings from the National Tuberculosis Coalition of America, or NTCA. My name is Donna Hope-Wegener, and I am NTCA's Executive Director. Although I wish I was there in Guam, in person, to deliver these introductory and welcoming remarks, please know that I am with you in spirit and in solidarity for the ambitious work you will accomplish today. The work you will accomplish today under the visionary leadership of Chima and Ashley and others in both of their organizations can be transformational for those living in Guam. I speak with confidence when I say your work will be transformational. Building on the work of the Guam Department of Public Health and the Toto Guam Foundation efforts, your work has immediate advantages. And it's not just the expertise and leadership of those two organizations. Critical to any of these initiatives is the political will to support such activities. You have that in the support already shown by your governor and lieutenant governor for the TB elimination activities undertaken on Guam. I know that they also will support these ambitious efforts to eliminate leprosy. Kudos for taking on this initiative, and the best of luck for your efforts today and in the future as you move towards a leprosy-free Guam.
Thank you so much, Mason, for supporting that. Before we proceed to our governor, I do want to acknowledge the presence. He's hiding in the back. Mr. Patrick Soto, our territorial epidemiologist. You can't talk about communicable disease without talking about him. Let's give him a round of applause. And now I want to give the floor to our governor, the Honorable Lourdes Aliangura, for her remarks.
Thank you very much, Crystal, and welcome to all such great people in the fight of leprosy here in Guam. And as I was listening to Therese here talking about the environment of leprosy here in Guam, I was actually amazed that we have those many cases in Guam. It's something that we don't really talk about. And it's truly a fact that it is a neglected tropical disease. But I don't think it is that neglected, knowing all the World Health Organization, all the other global international organizations that are really working together with us to get to our goals and our objectives. So I am very impressed with the work, of course, of Chima, and of course now Toda Guam, Ashley, connected with us to get this information out, to prevent the disease, to educate our community, to, like you said, remove the stigma. Because if we remove the stigma, we are more free to talk about it, and we are more free to address it, and we are more free to do something about it. And I think just having a proclamation and declaring the month, and of course the day on January 26th, goes a long way in community awareness. And because that's what we do when we proclaim things, and we lift it up to a greater community awareness. I'm also very excited for this Guam specific Path to Zero Leprosy, and all the interests, not just locally, but regionally and globally, to help us get to that level. And as we know from research and science and the evolution of leprosy, Hansen's disease, there is no reason to be afraid of it. It is very preventable, treatable, and that's the road that we should go down. I remember when I was growing up, I don't know, I think I'm the oldest, well, maybe sister here might be out there with me, but there was a designated place for leprosy there near Umatic. You know that history, Chima? Yes, there was a colony there. And that's where all the people who had leprosy were living. And then, of course, as science started coming in, then, people were educated. They didn't have to be isolated in a colony, and they were distributed out to their families, and, treatment and stuff started happening. But I do remember, even as a little girl, how fearful I was to even pass by that colony. And so, a lot of that, right, is just misinformation, being ignorant about it. And that's our job here as a community. And of course, as a government, we have to support those endeavors, those actions, those efforts that all our stakeholders from local to global are working together to get the message out. And to get the word out that we're going to work very hard to reach our zero leprosy. And as I understand it, that means no new cases, no transmission for a period of 5 years? Yes. And so let's start the period of 5 years in 2024.
We're already at 3.
Oh, we are? Oh, okay. See? Good work there, Chima, and staff and the management. So we have 2 more years, and then we can say, hey, we met our goal. Anyway, I just want to say, on behalf of the people of Guam, thank you so much for all your efforts in trying to continue to make us more communicable, disease-free. And all the efforts of all our stakeholders, everyone that do come to the table to help us make that happen. Because without you, without your support, and without your cooperation and efforts, we won't be where we are today as a island. So thank you, Sidus Masi, and let's continue working hard. And please know that as governor and as our lieutenant governor will attest, that we will work in every way and manner we can to support the efforts of public health and social service, and also Toda Guam, to move forward our action plan. Thank you, and Sidus Masi.
And now for the reading and the signing of the proclamation. Our reader today is Captain Chelsea Lewis, Anderson Air Force Base Public Health Flight Commander.
Proclamation number 2025-07, a proclamation of the governor proclaiming January 2025 as Leprosy Awareness Month and Sunday, January 26, 2025 as World Leprosy Day. Whereas this month, our island joins the nation in observing Leprosy Awareness Month and World Leprosy Day to recognize the physical and psychological damages of the chronic infectious disease and highlight the ongoing efforts to prevent new cases of leprosy and spread awareness on our island. Whereas leprosy, known as Hansen's disease, predominantly affects the skin and peripheral nerves. If left untreated, leprosy can have long-term consequences, including deformities and disabilities. Those affected are also subjected to the social stigma that surrounds the disease. Whereas each year, according to the Centers for Disease Control and Prevention, up to 225 people in the U.S. and 250,000 around the world are diagnosed with Hansen's disease, and 164 cases of Hansen's disease were reported in Guam from 2011 to 2024, with 11 new cases identified in 2024. Whereas this year's theme for World Leprosy Day is Unite, Act, Eliminate. This theme not only focuses on the call to eradicate the disease, but emphasizes the need for collaboration. Whereas early detection, contact screening, and post-exposure prophylaxis for all detected contacts with multi-drug therapy are a few of the many ways to alleviate the burden of leprosy and strive towards establishing a leprosy-free world, including our island. Whereas integrating counseling and health education are critical components in supporting leprosy patients and their families. These measures are essential in facilitating the completion of treatment, effectively managing the physical and psychological implications of the disease. Whereas it is crucial to underscore that leprosy is a treatable condition and should not serve as a basis for discrimination against individuals affected by the disease and their families through enhancing awareness of leprosy through all levels of education. Whereas our island observes World Leprosy Month and World Leprosy Day, we understand that through partnerships, our island can stop the transmission of leprosy, prevent new disabilities caused by leprosy, and promote inclusion, compassion, and respect for those affected by leprosy. Thank you.
Now therefore I, Lourdes Leon Guerrero Magahaga Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim January 2025 as Leprosy Awareness Month and Sunday, January 26, 2025 as World Leprosy Day. In witness whereof with the Segundo Magalahin Guahan, Josh Tenorio, together we have caused the Great Seal of Guam to be affixed in the capital village of Agotnia on this 24th day of January in the year of our Lord, Anno Domini 2025. Viva and onward to fight leprosy.
Thank you, Governor, for the signing of the proclamation. I now want to invite all our stakeholders in the room with us to join us in the front for a group photo. Have a great weekend ahead, and thank you so much for joining us for the proclamation signing ceremony for January 2025 as Leprosy Awareness Month and Sunday, January 26th is World Leprosy Day.